Welcome to today's lesson on viral diseases. In this session, we will deepen our understanding of what viruses are. We will use two specific example viruses, HIV and Ebola. We will examine their characteristics, transmission methods, and the impacts they have on human health. In our lesson today, we will first look at viruses, including their common structures and defining features. We will then look into the human immunodeficiency virus, commonly shortened to HIV. We will explain how it attacks the immune system, as well as what makes it such a persistent challenge in medicine. Next, we will explore the Ebola virus, which is notable for causing severe fever, as well as its high levels of lethality. By the end of this lesson, you will have a solid grasp of how these viruses spread, as well as how they affect the body. So far, you have learned that pathogens cause communicable diseases and explored various ways by which they are spread. This foundational knowledge will help us to understand viral structure and transmission. To begin, let's remind ourselves of what a virus actually is. Viruses are unique entities in biology. Unlike bacteria and other living organisms, viruses are not considered to be alive. This is because they cannot carry out most of the life processes on their own. Instead, they must infect a host cell in order to reproduce. All viruses share some common characteristics. Firstly, they are much smaller than bacteria. Furthermore, viruses can only replicate inside a living host cell. Viruses themselves are not considered cells. They don't have a cell membrane or organelles, such as mitochondria. Instead, they consist of a protein coat and contain either DNA or RNA as their genetic material. Finally, different viruses can infect all of the different types of living organism. HIV is a virus that targets the human immune system. It can lead to AIDS, acquired immunodeficiency syndrome, if left untreated. Understanding how HIV spreads and its symptoms, as well as its prevention strategies, are crucial for managing this virus. HIV can be transmitted via a variety of mechanisms. One example is through direct sexual contact. HIV can be spread through unprotected sexual intercourse with an infected person. A second mechanism of spread is in the exchange of bodily fluids. This includes blood, semen, vaginal fluids, and breast milk. HIV can also spread by sharing needles that have been contaminated with infected blood. Finally, HIV can be spread by vertical, or mother-to-child transmission. This can occur during childbirth or through breastfeeding. HIV also exhibits a variety of symptoms. For example, HIV often starts with flu-like symptoms such as fever, a sore throat, and fatigue. These can last for a few weeks. After the initial symptoms, HIV may not cause any more noticeable symptoms for several years. However, during this time, the virus is actively attacking the immune system. If it is left untreated, HIV damages the immune system to the point where it cannot fight off other infections or cancers. This is known as AIDS. Finally, managing and preventing HIV can be achieved via a plethora of solutions. The first is anti-retroviral drugs. These medications can slow the replication of HIV in the body, effectively managing the disease and extending the lifespan of infected individuals. HIV spread can also be managed by taking preventative measures. For example, a person might consider using condoms during sex, limiting the number of sexual partners, avoiding sharing needles, and getting screened after potential exposure. The Ebola virus can cause severe and often fatal disease in humans. Understanding how Ebola spreads, the symptoms it causes, and how to prevent transmission is important for controlling potential outbreaks. Ebola is spread through direct contact with the body fluids of an infected person. This can include blood, sweat, vomit, feces, urine, and saliva. The symptoms of Ebola can include headaches and high fever, as well as joint and muscle pains. In severe cases, the patient may develop a fever that includes bleeding, both internally and externally. It is often fatal. The management and prevention of Ebola can be achieved through various mechanisms. Firstly, infected individuals should be isolated to prevent the virus from spreading to others. Contaminated areas, as well as medical and personal equipment, should be sterilized in order to kill the virus. And finally, healthcare workers should use protective clothing and equipment when treating patients to avoid infection. In today's lesson, we studied the structure of viruses. To do this, we focused on two specific viral diseases, HIV and Ebola. We started with HIV, the human immunodeficiency virus, which primarily attacks the immune system and leads to weakened immunity over time. We covered how HIV is transmitted through bodily fluids and emphasized the importance of management methods such as anti-retroviral drugs. We also discussed that untreated HIV can progress to AIDS, acquired immunodeficiency syndrome, where the immune system is severely compromised. Next, we examined Ebola, a viral disease caused by the Ebola virus, characterized by severe symptoms such as fever, vomiting, diarrhea, and both internal and external bleeding. Ebola has a high fatality rate. It is transmitted through direct contact with the bodily fluids of an infected person or contaminated objects. We stress the significance of quarantine measures and safe clinical care in managing Ebola outbreaks. Throughout the lesson, we highlighted the importance of understanding both diseases to implement adequate preventative and control measures, reduce transmission, and improve treatment outcomes. By grasping these concepts, you can better understand the nature of viral infections, as well as their impact on global health.
Watch the rest of the GCSE biology course at Sophos Education.